That's a good question. And I'm going to be honest. I've always been involved as a student in my dental hygiene program. I was president of my class, and I thought I did a good job at being a hygienist. But when I graduated, and I wasn't so concerned about removing that last piece of calculus, I realized something very important. You know, my oral cancer screening protocol was not up to par. Sometimes I would check the thyroid, sometimes I wouldn't. Sometimes I would palpate the buccal mucosa, sometimes I didn't. And you know, the more I became part of the field, I knew that this was the most important part of my appointment, and yet I was not doing it comprehensively or consistently. And so I was approached by another hygienist who asked me if I would be involved. And I kind of shyly told her, you know, I'd love to, but I don't think I'm that good at it. And that's when I realized that it's okay if you're uncomfortable performing an oral cancer screening right now. What's not okay is if you don't do anything about it. And that's where I had the opportunity to learn and grow. And so that's why I'm involved today, because I don't forget where I stood at one point. You know, every expert at one point is a beginner, is an amateur, and that's all right. It really depends on your willingness to grow and to get out of your comfort zone so that you can get to the point where you're doing the right thing for your patients. Yeah, one of my favorite things that I do is be part of this annual fundraiser, which is the 5K walk and run that we do in Illinois. And I didn't have that hat on. What I mean by that is when I went to the event, you know, ready to go, I was ready to delegate to the volunteers. I was ready to make sure everything was seamless. And I did not expect all these survivors to come up to me and say, you know, what you're doing is making a difference, or thank you for this. Because the first years I got involved with this, I just had my leader hat on. I'm going to make sure this goes smoothly. I'm going to make sure this goes, you know, this goes down well. But it became emotional when I got to see those faces of why we're doing this. And that's really what struck a chord with me. So because I have that relationship with them, it's just reinforcement every time I'm back in my practice every day, practicing hygiene. Yes, I understand that this, you know, relatively quick exam can really make a difference, is making a difference in the patients' lives that we treat. You know, they trust us so much when they're in our chair, and you know, they almost won't notice if we're not performing the exam, but when we do it, they appreciate it, and they want to know what we're looking for and what we're feeling, and that is a rapport builder right there. I thought at first that it would be. I thought that as I learned more about HPV and the connection, you know, with it being, you know, a sexually transmitted infection, that it might get a little awkward in the chair. The truth is, though, the public doesn't know very much about it. So everything that I'm telling them, they're kind of a blank canvas. So I can paint a picture in a way that's appropriate for the dental chair, you know, letting them know that I'm looking for any oral abnormalities in the mouth, and let them know that we do this on all our patients, even if you've never smoked a cigarette in your life. You know, we do this on everybody because of the connection to HPV, which is a sexually transmitted infection, and they're receptive to it. So what I thought once, you know, at once might be awkward, in fact is the opposite. They want to know more about it. They want to leave there more informed. That's a very good question. Yes, I have seen offices that I've either temped at or worked at where, you know, that C word is almost danced around. And, you know, being a clinical hygienist, you know, I do have a job to do, and I want the patients to like me. I also want my boss to like me. So I understand how it can be a little off-putting when a patient who unfortunately hasn't been educated in the past about what should be going on at this appointment and is expecting just to be scaled, polished, and flossed. Now I'm laying them back and I'm saying, you know, I'm about to complete, you know, an oral cancer screening, and I start asking them these pre-screening questions. They're a little thrown off. I've never gotten negative feedback by that, though. I've always gotten appreciation for what I'm doing. I do understand how offices may choose not to use the word cancer, and I don't agree with that because I really think that patients should know exactly what we're doing so that they can make the best decisions, for them to lead healthy lifestyles. I also am very passionate about the role of a dental hygienist, and my vision is that the public will demand oral cancer screenings just like they demand to be polished, or just like they demand to get a goodie bag at the end of the appointment. And in order for that to happen, we have to keep talking about it. We have to make the oral cancer screening synonymous with the mammogram or the pap smear, and that's part of our mission. Oh, absolutely. The patients, if I'm lucky, only see me twice a year. An informed public is what's going to save lives. It's when patients know what to look for in themselves, along with just a self-screening palpation. If they realize that, chronic hoarseness that persists, or, difficulty swallowing, if they know this themselves, there's more of a chance that they'll catch something early on their own, instead of, if they may or may not come to the dental appointment. That's a good question. So I always scope out the courses and see what's going on at all the major trade shows. I have to say, unfortunately, when it comes to education on oral cancer screenings and early detection, there's maybe one or two to choose from at each show. It's not the most popular topic. As far as having a buzz on the trade show floor, that's something I desire to have more too. I want it to be almost trendy. I mean, it needs to be. This is dentistry's cancer. This is what we're responsible for, identifying oral abnormalities. And unfortunately, there's other things that are taking precedence when it comes to what's exciting and what's new at each trade show. Maybe it's a white strip, maybe it's another well-sponsored device. I'm not sure, but this is pretty black and white to me that oral cancer screenings save lives. We're the ones that can do it. And so I'd really love to see, the trendiness of oral cancer become more apparent at these big events.